When we find ourselves in a dangerous situation, the advice we've heard from family, friends, or even movies often comes to mind. But the truth is, not all of it actually works, and some of it can even cause harm. For example, many people think that applying ice to a bruise is the best way to reduce swelling, or that you should immediately lift up someone who has fainted. However, these actions aren't always correct and can make things worse. Today, we'll debunk 12 of the most popular survival myths and explain how you really should act in extreme conditions. These simple but effective tips could be the key to staying safe and helping others in critical moments. Number 12. What to do if a foreign object gets in your eye. Imagine a situation, you feel like something got into your eye, and an unpleasant irritation begins. What should you do? The main rule in this case is, don't panic and don't make sudden movements. But what if it's not just an eyelash, but something more serious, like a piece of glass? First of all, if a sharp or large foreign object is in your eye, under no circumstances should you try to remove it yourself. That could only make the situation worse by damaging the cornea or pushing the object in deeper. In such a situation, it's best to ask someone to take you to the hospital or call for medical help right away. If it's something small and harmless, like an eyelash or a speck of dust, proceed carefully. First, wash your hands thoroughly with warm water and soap. This is important to avoid infecting your eye. Then, go to a well-lit mirror and try to see exactly where the irritant is. To help your eye naturally get rid of the foreign object, try blinking several times in a row. Tears will help flush out the eyelash or dirt. If that doesn't work, you can gently use a clean, damp piece of cloth or a cotton pad to touch the inner corner of the eye and remove the irritant. After getting the object out, rinse your eye with clean water or saline solution for additional cleansing. This will reduce the risk of inflammation or irritation. Remember, even if you handled it yourself, but discomfort or redness continues, don't delay a visit to the doctor. Eyes are one of the most sensitive organs, and even a small injury can lead to serious consequences if not treated in time. So if something gets in your eye, stay calm, be gentle, and if in doubt, seek help right away. Your vision is worth protecting. Number 11. The myth about ointments on wounds. Why it's better to avoid them. Wounds are not only unpleasant but potentially dangerous. When we get hurt, the natural reaction is to grab whatever we can find in the first aid kit and quickly treat the damaged area. Many people instinctively reach for ointments, thinking they're a magic cure that will help the wound heal faster. But did you know that ointments can actually have the opposite effect? Most ointments create a moist environment on the skin, which, as it turns out, is a perfect resort for bacteria. Instead of healing the wound, they give bacteria a chance to multiply. This can lead to infection, slow recovery, and even inflammation. So what should you do to really help a wound heal faster? First of all, don't rush to grab the ointment. Start with the most important thing, clean the wound. Use cool water and mild soap to wash away dirt, dust, and potential bacteria. Don't use hot water, as it may irritate the skin more. After the wound is thoroughly cleaned, gently pat it dry with a clean towel or tissue to remove excess moisture. Then apply a dry sterile bandage to protect the area from outside contamination. If the wound is small, you can even leave it uncovered to let it heal naturally in the air. It's important to remember that our skin has an amazing ability to regenerate. Sometimes, all it needs is a little help, cleanliness and protection. If everything is done correctly, you'll see how quickly the wound starts to heal, without unnecessary inflammation or discomfort. So next time you deal with a cut or scrape, think twice before using an ointment. Sometimes, less is more, and the main thing for a wound is cleanliness and dryness. After all, nature can do its job just fine, as long as we don't interfere. Number 10. Why you should never rub someone with a fever. Using alcohol or vinegar. When someone has a high fever, many people instinctively turn to grandma's remedies, rubbing the body with vinegar or alcohol. At first glance, it seems like a good idea, it cools the skin, and it feels like the fever is dropping quickly. But did you know that this method is not only ineffective, but also dangerous, especially for children? The thing is, alcohol and vinegar don't just evaporate and cool the skin. They are absorbed through the skin into the bloodstream. In fact, by rubbing a person with alcohol, you could cause alcohol poisoning, especially if it's a child, whose skin is much more sensitive than an adult's. And vinegar, despite seeming harmless, increases the acidity in the body, which can also pose a serious health threat. Instead of turning to these outdated and unsafe methods, it's better to create conditions that help the body deal with the fever naturally. Start with the basics. Make sure the sick person drinks enough fluids. It can be water, herbal tea, fruit drinks, or berry juice. The main thing is to avoid dehydration, since the body loses a lot of fluid during a high fever. Also, pay attention to the room temperature. The optimal range is from 60 to 64 degrees Fahrenheit, 16-18 C. Fresh, cool air not only makes breathing easier but also helps the body cool down naturally. At the same time, there's no need to wrap the person in blankets, light clothing or a sheet is enough. Remember, chills are the body's way of fighting off infection. If the condition isn't getting worse, the body can often handle the fever on its own. But if the high temperature lasts too long or is accompanied by a serious worsening of condition, don't delay seeing a doctor. Forget about alcohol or vinegar rubs. In fighting a fever, safety and a smart approach are what matter most. Trust proven methods and modern medicine to help yourself or your loved ones recover faster. Number 9. How to correctly help someone who has fainted. When someone faints, many people start acting on common, but not always correct, advice. Some rush to lift the person up, others splash cold water on their face, hoping to wake them up. However, such actions may not only be unhelpful, but could actually make the situation worse. Let's look at what you should really do in case of a fainting spell. The first and most important rule: don't try to lift the person up. When the body is weakened, suddenly returning to an upright position can worsen blood circulation, increase the episode, or even lead to a second fainting. Instead, gently lay the person down on their back. To improve blood flow to the brain, slightly raise their legs, for example, by placing them on a pillow or a rolled-up blanket. This will help restore normal circulation more quickly and, as a result, stabilize the person's condition. Then, make sure nothing is blocking their breathing. Unbutton the shirt collar, loosen the belt, or remove any other clothing that may restrict movement or airflow. When the person starts to regain consciousness, don't rush to lift them up. Let them lie down for a little while longer so the body has time to fully recover. And finally, forget about coffee, tea, or any energy drinks. Caffeine can worsen dehydration, which is often a cause of fainting in the first place. Instead, offer the person a simple glass of water to help replenish lost fluids. These simple but correct actions will help the person recover faster and avoid complications. Remember, fainting can be a symptom of something serious. If fainting episodes repeat or the person doesn't wake up within a few minutes, call a doctor immediately. Now you know exactly how to act in such a situation, to truly help, not harm. Life is made up of small things, but sometimes, it's those small things that make all the difference. Number 8. Why oil and sour cream won't help with burns, and may even do harm when we get a burn. The first thought that often comes to mind is to use old trusted folk remedies, applying oil or sour cream to the burned area. These methods are truly popular, because immediately after applying a cold product, the pain seems to feel less intense. But did you know that this approach can actually cause even more harm to your skin? Let's figure out why that happens. The fact is, oil and sour cream have no healing properties at all. Their effectiveness comes only from the fact that we usually keep them in the fridge. The natural cooling temporarily soothes the pain, but that's where the benefits end. Oil and fatty substances create a film on the skin that disrupts heat exchange. Instead of letting the heat dissipate, it traps it and pushes it deeper into the tissue, making the damage worse. So what should you do if you get burned? First of all, forget the fridge and folk recipes. The correct action is to cool the affected area under cold running water. Do this for at least 15 minutes to lower the temperature of the tissue and prevent further skin damage. After cooling, leave the burned area alone. If blisters form on the skin, do not pop them under any circumstances. These are not just ugly bubbles, they are your body's natural protective mechanism. Blisters create a barrier that keeps infection from entering the wound. If you break that natural barrier, you could face inflammation, pus buildup, and a longer healing time. Remember, serious burns that cover a large area of the body or cause severe pain require medical attention. These types of injuries should not be treated at home, as they may lead to serious complications. So instead of relying on outdated advice, trust modern first aid methods. Your skin is an important protective organ and it deserves careful and knowledgeable treatment. Only the right actions will help it heal quickly and without unnecessary consequences. Number 7. Why you shouldn't reset bones yourself. Reality versus the movies. Let's be honest. Who among us hasn't seen a movie scene where the hero casually pops a dislocated joint or even a broken bone back into place right on the spot? It looks impressive, doesn't it? But reality is far from what we see on screen. Unless you're a professional trauma specialist, trying to fix a dislocated or broken bone on your own can turn into a real disaster. First, you risk causing the injured person even more pain and creating additional injuries. For example, incorrect movements can damage nerves, blood vessels, or even tear tissues. If the damage becomes worse, it may later require more complicated treatment or even surgery. Second, it's genuinely dangerous. Can you be absolutely sure it's a dislocation and not a fracture? If you make a mistake and try to reset something, you may worsen the condition instead of helping. And even from a legal standpoint, this kind of heroism could lead to problems. Imagine, you tried to help, and ended up being sued for causing harm. So what should you do if you witness such an injury? The most important thing is to immobilize the injured limb. Do this by gently securing it in the exact position it's currently in. Don't try to straighten or change its position. If you have a bandage, splint, or even just a piece of fabric, secure not just the injured spot, but also the two joints closest to it. This will help prevent further bone displacement. Then, get the injured person to a doctor as soon as possible, or call emergency services. Only a qualified specialist can correctly diagnose the injury and perform the right procedures without risking complications. Remember, your goal is not to become a movie hero, but to protect the injured person's health. The right actions in a critical moment can save not just their health, but possibly their life. Number 6. Why applying heat to a sprain isn't a good idea, and what actually works when we get a sprain. The first thing many people do is rush to apply a warm compress, hoping it will quickly relieve the pain and speed up recovery. This method seems logical, heat relaxes muscles, so why not use it? But in reality, this is one of the most common mistakes. Here's why: heat increases blood flow to the injured area, which is generally a good thing, but in the case of a sprain, it can actually make things worse. The increased blood flow can lead to more swelling and may prolong inflammation. As a result, you risk not only increasing the pain but also slowing down the recovery of the injured muscle. So what should you do if you pulled a muscle? Forget about heat, at least for the first 48 hours. Instead, turn to a much more effective method: cold compresses. Cold helps constrict blood vessels, which reduces swelling and inflammation, and also relieves pain. Use an ice pack wrapped in cloth to avoid frostbite, and apply it to the injured area for 15 to 20 minutes every couple of hours. It's equally important during this period to limit strain on the injured limb. If you keep moving around and ignoring the pain, you risk worsening the damage to the muscles or ligaments. Give yourself time to rest. This is a key stage in the recovery process. Once the sharp pain and swelling go down, usually after 2 or 3 days, then you can start thinking about applying heat. Warm compresses or baths can help improve circulation, which speeds up tissue healing, but only after you're sure the inflammation has passed. Remember, proper treatment during the first hours and days after an injury is half the battle. So choose cold instead of heat, give your body time to recover, and you'll get back to normal activity much faster, without extra complications. Number 5. Why inducing vomiting in cases of poisoning is a dangerous myth, and what to do instead when someone is poisoned. The first thing that often comes to mind is to make them vomit, to get the poison out of the body. This advice seems logical and even life-saving, but in fact, it's one of the most dangerous and false myths. Let's take a closer look at why. First of all, inducing vomiting can be extremely dangerous, especially if the poisoning is caused by chemicals like acids, alkalis, or household cleaners. When vomiting, these substances can damage the throat and esophagus a second time, doubling the chemical burn injuries. Moreover, there's a risk that stomach contents could enter the airways, which can lead to serious complications, including choking or lung damage. Second, even if vomiting starts on its own, stopping it isn't easy. Repeated vomiting can lead to severe dehydration, which worsens the overall condition and makes treatment harder. So what should you do if you or someone nearby has been poisoned? The first and most important rule: don't panic. Call emergency services immediately. Tell the dispatcher exactly what happened, what substance was swallowed, how much time has passed, and what symptoms the victim is showing. This will help medics quickly determine the right treatment. If you know what caused the poisoning and you have the container or packaging, keep it and give it to the medical team. It will help them understand what they're dealing with. As for what to do before the medics arrive, never try to induce vomiting, and don't give the person any medication unless instructed by a professional. In some cases, you may be told over the phone to give the person a small amount of water to dilute the poison, but only if advised by emergency responders. Remember, trying to handle poisoning on your own without medical knowledge can lead to serious consequences. Trust the professionals, and never believe dangerous myths about vomiting being a universal solution to poisoning. Number 4. How to properly save a drowning person and not become a victim yourself. When we see someone drowning, our instinct immediately tells us to jump into the water and help. But saving a drowning person is not only an act of bravery, it's also a serious challenge that requires the right approach. Often, the panic of the drowning person can turn the rescue operation into a danger for both of you. First, remember the main rule: your safety is just as important as the life of the drowning person. If you are not confident in your abilities or don't know how to swim at all, do not jump into the water. In such cases, it's better to find a long object, like a stick, rope, or even clothing, and reach it out to the victim. If there is a boat or life ring nearby, use them. But what if help is needed right now and you are confident in your swimming skills? When swimming up to a drowning person, it is very important to be careful. The drowning person is in a state of panic and may reflexively grab onto you, making movement difficult and putting you in danger. That's why it is recommended to approach the victim from behind. This way you avoid being grabbed. When you get close, grab the person by the chin or under the armpits. This hold allows you to keep their head above water while maintaining your freedom of movement. Remember, your task is to keep the drowning person's face above water and move towards the shore or the nearest place where you can stand. It's also important to watch the victim's head position. Keep it at your waist level. This will help minimize water resistance and allow you to move more efficiently. Saving a drowning person is a situation where staying calm is crucial. If you manage to bring the person ashore, check their breathing and condition. If necessary, start CPR and call for medical help immediately. And finally, remember that the best rescue is prevention. Teach children to swim, explain water safety rules, and of course, never ignore potentially dangerous situations. Because one simple rule or bit of knowledge can save someone's life. Number 3. How to properly act if a foreign object remains in a wound. When you get a minor injury, like a splinter in your finger or a small piece of glass in your hand, you might instinctively want to remove the object right away. This is quite logical, and in such situations, we usually handle it easily. But what if the injury is more serious and a large foreign object is left inside the body? This is much more complicated and dangerous than it seems at first glance. In such cases, it's important to understand, despite the obvious danger, you should never try to remove the object from the wound yourself, even if it looks insignificant. For example, if it's a knife or another sharp object sticking out of the leg or another part of the body, trying to remove it may cause massive bleeding. Even professional medics do not remove such objects immediately. On the contrary, they leave them inside the wound until the patient reaches the operating room, where specialists remove it correctly under control. Why is it important to leave a foreign object in the wound? Because when an object remains inside, it actually helps stop the bleeding. It acts like a natural bandage, slowing down blood loss, which can be critical, especially in an emergency. If you try to remove the object, you can provoke heavy bleeding, which will significantly worsen the condition. So what can and should you do while waiting for medical help? First, don't panic and don't try to remove the object. If the wound is large and painful, try not to move and avoid putting strain on the injured part of the body. To minimize the risk of infection, you can gently clean the edges of the wound with an alcohol solution or antiseptic, but try not to touch the foreign object itself to avoid further tissue damage. For less serious injuries, for example when there is only a small splinter in the wound, removing it is quite simple. But for large objects, knives, glass, or other dangerous items, remember that time is critical. Waiting for medical help and getting to the hospital is the best strategy to prevent complications. Thus, in serious injuries, it's important to stay calm and think clearly. The main thing is to seek timely medical care and professional help. Number 2, how to properly apply ice to a bruise. What you need to know when you get an injury and notice a bruise, the first thing that comes to mind is, of course, to apply ice. This is a proven method that really helps reduce swelling and pain. However, despite its popularity, many of us make a mistake by applying ice incorrectly. In fact, improper use of ice can cause additional problems, and to avoid them, it's important to follow a few simple guidelines. First, never apply ice directly to the skin. This can cause so-called cold burn, which is essentially tissue damage from too low a temperature. To prevent this, always use a cloth or towel between the bruise and the ice. This will help soften the cold's effect, but even with a cloth, you should not overdo the time of exposure. Ice should be kept on the injured area for no more than 20 minutes at a time. After that, be sure to take a break for at least 90 minutes before repeating the procedure. If for some reason you don't have a cloth or towel nearby, it's better to skip using ice altogether. In that case, the bruise won't get worse, but a cold burn from the ice is quite possible, and it will do more harm than good. Finally, it's important to remember that ice should only be applied during the first 48 hours after the injury. This is the optimal period when cold helps reduce inflammation and prevents further worsening of the condition. After this time, ice won't have the same effect, and you can switch to other treatment methods, such as warm compresses, which promote better healing. So, don't forget these simple rules. Ice really helps, but only if used correctly. Number 1. How to stitch a wound. What you need to know about stitches and alternative methods. Wounds require immediate attention, and in most cases, stitching is the only effective way to close the damaged area and speed up healing. But it's important to remember that getting stitches is not only a lengthy but also a painful process that can come with unpleasant sensations, especially if the wound is deep. Also, after healing, stitches will need to be removed, which can also cause discomfort. However, in some cases, you can do without traditional stitches. For example, if the wound isn't too big and doesn't require surgery, a special skin glue can help. This glue sets quickly, doesn't cause much pain, and is a great alternative in situations where stitches aren't mandatory. The main thing is to follow the instructions exactly and properly prepare the wound before using the glue. Start by thoroughly rinsing the wound with cool water to get rid of dirt and germs. Then gently press the wound to stop bleeding. After that, carefully bring the edges of the wound together and apply the glue, which will bond the skin and help it heal. This method is suitable for small cuts or scrapes and can be quite effective if used with care. However, remember that if the wound is too large or deep, it's better not to take risks and seek professional medical help. In such cases, traditional stitches or more serious interventions will provide reliable protection and minimize the risk of complications. So, if the wound isn't too serious, skin glue is a great way to handle injuries. But if you're worried about the size of the wound, it's best to trust the doctors and not try to treat it yourself. Thanks for watching this video till the end. We hope these life hacks were helpful and will assist you in a difficult situation. Life can be unpredictable, and the ability to react quickly is true strength. If you liked these tips, don't forget to hit like to support us, and of course, subscribe to the channel so you don't miss new videos with useful advice. Write in the comments which life hack you liked the most, and if you have your own tips, share them. Take care and be ready for anything.